Good morning, everyone. I'm Jessica Lovell, in for our Chief Medical Officer, Dr. Steve Stites, who is taking some much-needed time off. He will be back Monday, though. Welcome into the morning update on COVID-19. We are here inside the Dolph C. Simons Jr. Family Broadcast Studio. And today, it is all about masking. Kansas Governor Kelly has called for mandatory masking, and we have a great panel of guests to help us really better understand what that is going to mean for all of us. But in short, you need to wear a mask. But it's really not that easy when it comes to businesses. So we are going to talk with the president of the Overland Park Chamber, Tracey Osborn Oltjen. And also joining us in studio is Dr. Joseph LeMaster. He is the Johnson County Public Health Officer. So we will talk with him about some of these business issues and public issues. So far right now, 19 states are requiring masks in public, and Kansas, as we said, just became one of them. That will go into effect on Friday. The science has shown that masks work and they help prevent the spread of COVID-19. KDHE Secretary Dr. Norman, he is going to dive deeper into this new state mandate and kind of the do's and don'ts and what it means for everyone. But before we start this conversation this morning, let's hear the inpatient numbers and some opening thoughts from Dr. Dana Hawkinson. He is the Medical Director of Infection and Prevention and Control. Good morning. How are you?
I'm good.
Good. Okay, so we're going to talk masking, but let's talk numbers first.
Mm-hmm. Yeah, at the health system here in the hospital, we are doing very good again. I stated this yesterday and before that. We were really concerned because our numbers were going up from a really low point of 9 or 10 patients in the hospital. Today we are at 16, so we actually did have a discharge. But we've had actually other discharges, but we had more admissions as well. So today our numbers are 16. We do have 3 on the ventilator. But, you know, if we can keep those numbers low and continue to get discharges, I think that's a good thing. We know that our health partners and our other community hospitals, overall, the past 1 to 2 weeks have seen an increase of patients as well.
So the numbers here encouraging?
They are encouraging, yep. But, you know, again, what's not encouraging is the amount of new tests that are positive and the percentage of those tests, of all the tests that we're doing. So we do understand that when you do have the disease and you get diagnosed, for the most part, you're not going to be looking for medical treatment for about a week or 10 days after the original symptoms occur. We know that too. So I think we just kind of have to continue to say, let's see what happens in 10 days. Let's see what happens in 14 days. We'll have a lot better information.
So it brings us back to our topic of wear the mask.
Masking.
Like you always say. So I want to show an illustration of kind of how masks work, really kind of what your droplets and spit is doing when you sneeze and cough. Tell us what you're seeing here and how it works.
Yeah, again, this is, you know, amazing in the time of COVID now. Hopefully a lot of people are learning to understand about infection dynamics, infection prevention. This is one other aspect of science and experiments that hopefully people are starting to learn about. This is just a study from a group from Florida Atlantic University where they used again, it's a laboratory model, so it's a mannequin. It's not a full human model, but this is the best we have at this point, and it demonstrates it very well. What it basically shows is that a mannequin without a mask and a simulated cough where they puff air through, and they show droplet particles, which are lit up by a laser light. There's also one with a mask, which was a bandana, which, you know, we've always said, and really the CDC has also said, you know, anything to cover your face. So it certainly works better than having your cough uncovered, even with a bandana. And then the other one is more of a stitched, pleated cotton mask. And basically what they were showing is how far do droplets travel, how good is the barrier protection if you don't have anything, if you have a bandana, or if you have a stitched or pleated cotton mask. And what it showed basically was that stitched pleated cotton mask probably worked a little bit better than the bandana for blocking as a barrier to your droplets.
Something is better than nothing.
Yes, absolutely.
All right, so we want to check in now with Dr. Norman. Dr. Norman, can you hear us?
Hear me okay, Jeff? Yes, I can.
Oh, so nice to hear your voice, and thank you for joining this conversation. We'll have a lot of questions for you today, but can you just kick us off and talk a little bit about what does this mandatory masking rule, if you will, what does it mean, and kind of what are the exceptions? What do we need to know?
Well, first off, the executive order isn't isn't released until tomorrow. So I do not know the exact language except what Governor Kelly and I have talked about, and then she talked about at the press conference on Monday. But it's just what you said. It's in public places and outdoor spaces when distancing can't be maintained, that a mask will be worn. There'll be discussion about enforcement in the executive order. Like most things that in executive orders, the enforcement is done locally at the local municipalities and counties, which puts admittedly pressure on those law enforcement agencies to do that. And I bet you Dr. Joe LeMaster will have some thoughts on that because he and I have talked about it in the past. Ideally, people would comply with this willingly. We've seen, obviously, that that's not the case, that the best advice hasn't necessarily led to that. And I think it'll be a real struggle, quite honestly. I will also comment that the executive order has to go through an approval process. The legislature in Kansas has been actively limiting the governor's executive authorities, including executive orders. And the State Finance Council is meeting tomorrow. They're the ones that have the authority to override or modify those orders. So as much as I'd like to tell you it's buttoned down, ready to go to print with this right now, he'll have to wait till tomorrow to see, one, what the final executive order looks like, and then secondly, what the State Finance Council has to say about it.
Dr. LeMaster, what are your thoughts?
Well, of course, thank you very much, Jess. Glad to be here. Very much looking forward, I think all of us are, to seeing what is in Governor Kelly's executive order. As Secretary Norman said, it's a bit difficult to debate the merits or demerits of it by anyone until they have actually seen exactly what's in it. On the other hand, we know very clearly from the science and a number of studies now being released that are unequivocal that wearing masks of various sorts, not just N95 masks or surgical masks, but also homemade cloth masks, will dramatically reduce the risk of COVID in populations. Somewhere in the neighborhood of between, depending on the type of mask and how it is, and in what situations it's worn, somewhere in the neighborhood of 50 to 85%. And there's a couple of studies that are out there that make it quite clear that if we had 100% compliance, adherence to wearing masks across the population, that we could reduce the reproduction rate, the way that the virus spreads in the community, and get this thing under control. So I think that there's no question that we should be recommending, and we have been recommending at the county level and all of our public information outlets for people to wear masks in every situation. We're seeing lots and lots of examples around the county where that is not happening, especially indoor spaces. We're especially concerned about when people are in close quarters in things like bars and restaurants where they are eating anyway. And of course, as we've said, you have to take it off when you put the food in your mouth. But there are lots of other situations where people are not wearing them, and we think that this may be contributing to the problem. There's a lot more transmission, a lot more cases in younger populations than we've ever seen before. So strongly recommend, strongly back the wearing of masks, the promotion of masks in every way that we can actually help our population to actually do it. The point is getting people to do it.
Well, hopefully this will help. I want to bring in Tracey Osborn Oltjen. She is the president of the Overland Park Chamber of Commerce. This no doubt will affect businesses. Tracey, good morning to you. I just wanted to find out, first of all, how you are supporting local businesses. What specifically are you helping them resource-wise as they navigate through COVID-19?
Well, good morning. It's a pleasure to be here. From the very beginning, since the middle of March, we really felt that the best way that we could support business was to be the very best curator of resources for them. You know, as with everyone, regardless of what type of business you were in, this took you completely by surprise. And so there were really two main priorities for resources. One was figure out how to keep your employees and your customers as safe as possible. And the second, for many of our businesses, was to figure out how to pivot and work remotely, or to figure out how to work with as a reduced staff if you had a public-facing but essential business. And so we, along with other chambers across the region and other business organizations, really worked as much as we could in tandem to be the best curator of those resources through our websites and as much personal contact with all of our members as we could. So that was phone calls and emails, really relentlessly over the last couple of months.
We want to get to some questions this morning. I want to open it up to the media. Any questions from media this morning?
Good morning. It's Cindy from KCTV5. I just wanted to ask probably Dr. Hawkinson about this Chinese study that says the antibodies from the COVID-19 patients fade quickly for those with symptoms as soon as 2 to 3 months, and for people asymptomatic that had some, they fade as quickly as 8 weeks. Can you comment on that at all? I appreciate your response.
Yeah, absolutely. So the best evidence we have for immunity and antibody levels really come from the older SARS studies, in which they showed, even with MERS, you can have antibodies for 2 or 3 years. Obviously, we are not that far out in our infections yet with SARS-CoV-2. So we would expect that you would still have antibodies at least for a year, 2 or 3. Again, this is one study. Interestingly, it did also show that people with milder or asymptomatic disease, just as you said, had maybe lower amounts of antibody. We don't know if there's cause and effect there. We really don't understand exactly, why that would be. It's hard to make sense. Do you have decreased disease because you aren't making the antibody, or do you have decreased antibodies so you have decreased disease? It's really hard to tell. We don't really know which is the chicken and the egg there. But as we get further information, and this will, will be studied here and in Italy and all the other places where they are showing SARS-CoV-2 infections. It's an interesting point. I think it's an interesting observation and needs to continue to be studied. Again, we would still hope, based on other common coronaviruses, the common coronaviruses that cause the common cough and cold, of which there are 4, that you would have some sort of immunity, at least 3, 6, 9 months, maybe a year. We don't know to what extent that immunity would be, but we also know that people who are reinfected with the same common cough and cold coronavirus, even at 9 months, can still get the disease again, even if it's more mild. So there are still a lot of questions about immunity and what happens with re-exposure to the infection after you are recovered from COVID. This is just one more data point that we can look at, more information that we can take. Hopefully moving forward we will get further information and really be able to sort all of this out.
Any other media questions?
Hi, this is Brian Grimmett with the Kansas News Service. The messaging on masks has been pretty consistent for at least a couple months now. How frustrating is it that it's in some places the public doesn't seem to be taking it all that seriously? I mean, when you guys know that masking can help stop the spread and people still aren't doing it anyway.
Dr. Norman, do you want to take that question?
Sure, I'd be happy to. It's a good question. It is very frustrating. And I think at its core, and I think I'm getting a little better understanding. I met with the State Fair Board yesterday, for example, and they had very interesting questions for me. And I think one is that I think it is perceived that we've been inconsistent in the messaging, saying early on that masks weren't required, even though much of the origin was we were trying to preserve masks for first responders, healthcare providers, and the like. And then secondly, I think people, and I'm beginning to learn this, that I think people are attacking the idea of masks when in reality what they're saying is we think that the magnitude of the response is in excess of the risk to us. And when you look around the state of Kansas, and I know this is true in Missouri and others that have a lot of rural and even frontier areas, people say this is not a risk to us, so don't tell us to wear a mask because the treatment is worse than the cure. We've heard that banded around. So I think people, even those that are naysayers, say, fine, it's okay, I understand masks do work, but we're not going to wear them in my county because we don't have the disease burden isn't significant enough to merit that. So it's really a mixed bag, but all in all, you're right, it is frustrating.
LeMaster?
Thanks. I certainly agree with everything Dr. Norman just said, and thank you for the question. I think in the counties where we have a lot more of the disease burden, there's no question that that we feel a lot of frustration and alarm because we are seeing an increase almost day by day of more and more cases. There is I think very little evidence in that would say that wearing a mask is in any way harmful to anyone. We have our staff in our hospitals wearing masks for hours on end and have been for years in surgical situations. We don't have any evidence of people having bad effects as a result of that. Obviously, there are going to be certain circumstances where people have got certain health conditions where that is limitation for them wearing a mask. We understand that, and I fully expect to see in Governor Kelly's order something that will deal with that. But I think that the concern that was raised is a really important one, and that is that we have been giving very strong recommendations for a number of weeks, certainly since the very beginning of reopening, that masks should be worn, that social distancing should be happening, and yet we're seeing all around our area, and in Johnson County in particular, where that is not being followed. And so we're now at a point where we're kind of wringing our hands about what to do next because the case numbers just keep going up. And following that, we have not yet seen an overwhelming surge of hospitalizations, but everywhere else where we're seeing these case numbers go up, they're there. And so we fully anticipate a drain on our critical care resources and stress coming on that, not months from now, but days from now. There's also another point which I think I'd like to make here, which is a little bit of a side point, if I may.
Please do.
And it has to do with the hospitalizations. I think we've had a lot of people asking, well, so if there is not a surge in hospitalizations right now, what's the big deal? Well, part of our issue is that we are right in the middle right now in the Kansas City area of a transition in the data systems that have been tracking hospitalization. So we don't have a really good feel for the number of people who are in hospitals. So not all the hospitals are reporting. Some of our hospital systems move patients with COVID across the state line to other hospitals after they've been hospitalized. So we're right in the middle of a transition time, and we are doing all we can just to keep up with the case investigations of new patients that are people who are being diagnosed with COVID, just to try and find out who their contacts are and all of the rest of that. And so it's possible there could be some hospitalizations. We know of some cases where there have been people hospitalized that we hadn't heard about for some time. So all of that work is going on. We're doing all we can to try and get that information, get those things in place. But right now, the data's we're a little bit shaky on hospitalization data, but we do anticipate if these numbers continue, seeing those numbers go up.
Dr. Hawkinson?
Yeah, absolutely. By Dr. Steitz's calls with the other CMOs at the other hospitals, they have said that their numbers have gone up. Yeah. So I think Ford and Finney County with that huge outbreak has been very lucky and not seen an overwhelming of their resources. But overall, in the community, certainly the hospitalizations have been going up.
Any more media questions this morning? All right, let's jump in. Jill, do you have a question from our viewers?
Yeah, we got lots of questions as always. And we know that Dr. Norman has to jump at 8:30 because he has a briefing. So Sarah has a question for Dr. Norman. She says she has travel plans for in August for the family to a state that has recently been put on the quarantine list. She knows that when she gets back, there's not going to be enough time to quarantine before she goes to school and before the kids go to school. She points out that although the county I'm traveling to is not as infectious as the other, she wants to know what you think about that and what advice you have for her.
Yeah, that's a good question. Very pragmatic one. And let's start with let me give a brief explanation. We have so much, as Dr. LeMaster points out, we have here in the last 10 days, probably about 300 new cases of COVID-19 a day in Kansas. That's without importing any. So we feel that it's really important not to import COVID-19 cases into the state of Kansas. And that's the reason for having this travel quarantine upon returning from those high prevalence states. How do we decide on what is a high prevalence state? What we do is we look at a 14-day rolling average of the rate of new cases, and we select those that are 3 times or greater than Kansas. So in other words, 3x what's currently going on in Kansas. And that results in about, as you see on our website, about 5 or 6 cases. The most recent ones obviously were Florida, South Carolina, and we are due to update that. I believe that will be today again. If we had even two times the number of cases going on in Kansas, that would be 30 or more states, which would obviously become impractical. So I guess the summary is if a state is going the wrong direction and we're looking at it on a rolling 2-week average, then it does put people into awkward positions if they travel to a state, for example, that's not on the list, and then it changes when they're there. Then that is, it's expected that they will quarantine for 14 days. My recommendation is if a person's going to go to a state that's on that quarantine required list, that they should really reevaluate whether they're going to do that or not, because the expectation would be that they'll quarantine themselves for 2 weeks upon return.
Other questions? Or
Great
Dana,
answer.
did you have anything to add on
Great
that?
answer.
Okay, Donna is writing in, and she'd like to know if there's some clarification between the state and the county. Her question has to do with why Johnson County the county commissioners didn't issue their own mask wearing order. She's wondering if it was because the county health department was waiting on the state health department. She's taking her information from the newspaper. Is there any clarification around that?
Thanks for the question.
On the timing?
I guess that will be for me. For one thing, the first thing needs to be said is that since we've started the reopening process, we've never stopped promoting and recommending and strongly urging all of our residents and people who work in Johnson County to be wearing masks. We've not been unclear about where they should be wearing them or who should be wearing them or how. So that's been very strong. There's been a debate around the mandate. As you know, it's a highly politicized issue, whether people should be legally required to wear masks. This is going to be discussed in a Board of Commissioners committee meeting tomorrow. Until the last couple of weeks, we've been following, we're still following the gating criteria that you can find on our county website, following what the White House's gating criteria were. And we had continued to see decreases in the number of cases, the percent of cases that tested positive, hospitalizations, and other things that we're tracking, like the number of people who show up in emergency rooms that appear to have COVID-like symptoms. All had been going down. Everything was looking good. So, if you're going to do something as significant as putting an additional legal requirement on people, you really need to have some data to be able to support doing that. Well, I think now we're seeing the cases going up, the hospitalizations are soon to follow, we believe. All of the other parameters are going in the wrong direction, are going in the positive direction, upward. So we're now in a situation where it makes sense to have that debate and have that and make that decision. And if people want to tune in, that meeting is, I think, at least publicly available online. I'm not sure how you can go to our county website to be able to get more information.
This next question would probably be one for Tracey and then maybe for Dr. Norman and the rest of you to add on. Janessa wants to know, if the mandate is left up to the counties, will JOCO mandate it? And she's going to all these businesses and she's seeing that they're not wearing masks. She wants to know, Tracey, what can she do to help? What information do you need? What needs to happen?
Well, that's a great question. I think that one thing that customers can do or clients can do is to ask questions and be informed. We're in the process of surveying our members, in advance of meetings like Dr. LeMaster talked about, committee meetings at the Johnson County Commission, and we're already in that process when the state mandate was issued to begin on Friday. And what we're finding is that, even though we haven't closed the survey, that already 70% of our members have indicated that they already require masking in some form, either in all cases for their employees or at least in the common areas for their employees. And many others already encourage masking for both employees and customers. That said, we already know that we've referenced earlier in the show that there are certainly other businesses out there that don't require or perhaps even encourage. And so I think in those instances, we have to be informed as consumers if that is something that is concerning to us. You walk with your feet. If you find yourself in an environment, whether it's masking or any other issue, that you don't like what you see with a business, often, you say something or you simply are not doing business with that business any longer. What we're finding is that our businesses are complying with the encouraging guidelines that have been issued by state and local governments from the beginning, even though those were not mandates, because they want to make sure that their employees feel comfortable about coming back to work from the beginning. And that really, whether it was mandated or not, we find that many of them are doing it already.
Do we have another question for Dr. Norman before
We
he has
do.
to get out of here today?
We do, and this was kind of a good one. Carol, I mean, they're all good. Why do I say that? These questions, and they're getting harder. I'm glad I'm just asking them and not having to answer them. So this person wants to know, what are we doing? What is the state doing in some of the rural, more frontier areas that are having COVID cases and having spikes? She's concerned about the burden on smaller hospitals in rural areas. How do you speak to that? She wants to know, why don't you get tougher on them?
Dr. Norman?
Was that for me, Jill? Hello, was that question for me, Jill?
Yes. Can you say why
Yes.
you're not getting tougher?
Well, first off, there's less burden of disease in the rural counties, and the rural counties that have had problems have basically meatpacking plants or some other congregate settings that, for example, a skilled nursing. We have not had much in the way of community spread in the more rural counties. And it's pretty hard to sell job, much like Dr. LeMaster said, when there's to go in and be viewed as kind of heavy-handed when the people locally say we would like to self-determine at the county level what we do. What we try to do is not get tough so much as to be aggressively helpful. And this has become important, like in liberal Kansas, Seward County, Ford County, Finney County, and to a degree Lyon County that have this mismatch that are indeed rural. They've got them, and yet they have big outbreaks. So we have taken in all sorts of testing equipment and assisted the hospitals with personnel, ventilators, testing, and then try to educate, because all these people, yes, they work in congregate settings, but they also go home. And as one person said to me in Dodge City, quote, every backyard is a cantina, unquote. So we don't know if people are acquiring it at work necessarily or in their backyard at parties, but they are getting it. So we try to be aggressively helpful and rely less on heavy-handed restrictions. We might, but when the numbers go the wrong direction, that's when executive orders come in, and hopefully that the legislature will allow them to stick so that they will be tougher.
Dr. Norman, we know you have a busy morning this morning. Can you give us some final thoughts before we let you go?
I'm agreeing with my colleagues in the room, and these are very sophisticated questions. And all I can say is that there's, some people do the right thing because the principles are being adhered to. And there's a lot of people out there, particularly, I think, older people who themselves feel threatened. And, the principles, we've gone over them a million times. Most people could tell them in their sleep about hand washing and social distancing and mask wearing and the like. There's a lot of people that do that, but there's a lot of people that just look at the rules and say, okay, I have a new challenge on my hand. I'm not doing Sudoku. I'm figure out how to skirt around the rule so as to not have to do something that's in the rules, even though the principles are baked into the rules. Those are the ones that are extremely frustrating and the reason that rules exist. And all I can say is people, from last Monday till morning till this past Monday morning, we have had over 2,000 new cases in the state of Kansas. We're lucky and fortunate that it's a younger population for now and a less hospitalized and less per capita death rate for now. But that is not going to remain as long as we have the burden of new disease cases coming up, because it will not remain in the 25 to 40-year-olds. It will spill over into those other, because it is community spread, even into those other settings that are congregate living situations. Good example is Oswattomie State Hospital. We have a problem there. And that did not crop up. That is not a different virus that somehow cropped up. It was brought in by community spread through staff members. So we have to remember that, yes, the age is coming down and we're getting by a little bit, but we cannot let our guard down.
Dr. Norman, we made a hashtag out of your words, don't skirt the rules. So we are driving it home from out here. So hope you don't mind.
Okay, bye guys.
Guys, and thanks.
Lee.
Have a
Thank
good
you.
day.
All right,
All right, questions.
Yes, Michelle wants to know, and we're sorry, Michelle, she had asked this earlier this week, and again, tomorrow we're going to rock through questions that didn't make it this week, but her question is, they're coming in so fast, I missed it, jumped on me. She wanted to know about the incubation period. She felt that it might be shorter than originally thought, 3 to 5 days versus 10 to 14, and she wants to know, is it shorter in children? And this could be, you want to clarify for her, because it could be just reading so much stuff.
Yeah, there are a lot of numbers and data out there. So the best evidence that we have, and this has really been consistent, I know a lot of our messages have changed because our knowledge has evolved. This has really been fairly consistent. I don't think there's any difference to this. So one of the best publications that we have is that the majority of people are going to develop symptoms by 5 to 7 days. By 11 to 12 days, 98% of people or more who will have symptoms will probably have symptoms. There is that smaller proportion, maybe around 1, 2, 3%, who will develop symptoms as quickly as 2 days. So there are different numbers there, but the main thing to remember is that most people will probably have symptoms by 5 to 7 days after exposure to the virus. And again, by 11 or 12 days, most everybody who will have symptoms will probably have symptoms by that. Now, there will be that small percentage who fall with outside of those lines, maybe 1 day after exposure, or maybe more than 14 days after exposure. But for the most part, you are looking at 5 to 7 days.
Lindsay and a couple of other people are asking about, should I wear 2 masks? And should my children wear 2 masks when they go to the park? There are some people, we've got people over here that are like, if one's going to do it, maybe I need 2, and I want to do it better because they don't want to get COVID and they don't want to spread it. And then that's kind of interesting next to people who don't want to wear it.
What would you say?
I was just reading about this last night, and I ran into an article that said you should put a nylon stocking over your head, over the top of the mask. So there's lots of people thinking about all of this to sort of reduce flow.
Yeah, that's what
I think
was
that I think that the evidence that is really clear that we have is that when you're in a situation where you and the other person that you are within any distance that you could transmit the virus, and we know that that's within 10 feet pretty much. If you're beyond 10 feet, the transmission's almost nothing. But if you're in that situation and each of you are wearing a mask, that the likelihood of transmission goes way, way, way down. So that's the situation we want people to be in. We want if everyone is wearing a mask, then when people get into close contact with each other, when they're around each other, then that is going to really improve things a whole lot.
So should it be 10 feet instead of 6 feet?
Well, the reason why I say that is that there's actually there's actually some studies been done that have looked at sort of a curve of transmission, and it's at 1 meter, which is about 3 feet. It has significantly less. 2 meters is less. 3 meters is even less, but not as much less as between 1 and 2. So the optimal distance that we've said was 2 meters or 6 feet. But there is still some continued decrease by going out even a little bit further than that.
So the farther the better.
Absolutely,
Right. Jill?
There's a person asking about the survey, and I don't know if Tracey mentioned it or if this person has heard about it, but can she speak to the survey and who can take it and and where they might find it.
Yeah, Tracey, we talked about that yesterday. You were telling me about the survey. Can you get us up to speed on that and where businesses need to go to access that?
Oh, I'm happy to. Right now, it's just a small survey of our Overland Park Chamber member businesses, and so it's not a scientific survey by any means, but really just kind of a litmus test for us to have a feeling of where our members stand. So it's not really a public survey at this point, but just a way for us to get a feel for where people are. Are they requiring or encouraging masking of their employees and or their customers, and also how they feel about mandates, whether they're from the state of Kansas or the county, and if so, what are their motivations? You know, if they are concerned about a second wave and public health, or if they're looking at that from a liability standpoint. So we just issued that survey yesterday, and it will close of business tomorrow. And so far, the interest in that has been intense from our members, more so than any other survey we've ever sent out. Already we have almost 670 responses.
And where did those responses go? What are you going to do with those?
They come to us, and we'll use those to help inform policymakers. So, I think at this point, based on what Dr. LeMaster said, we'll be sharing information, obviously, probably first with the Board of County Commissioners in Johnson County, because it looks like they first will be looking at, whether or not they're going to add a little bit of meat from the Johnson County perspective on masking.
Tracey, and as I know you don't have those survey results back yet, but we were speaking earlier about that it's not just as simple as masking is very pro-business, it seems like to many people, but you said that's not necessarily always the case. There's liability issues and there's a lot of controversy, as we know. What are you hearing, though, so far from business leaders?
Well, you're right. It is not a simple issue. It's not just a cut and dry, but it's really interesting that the narrative, along with the science and the more we learn, the narrative is starting to change. When Dr. Norman talked about, the treatment is really worse than the cure. We're hearing that narrative start to change now. What we're learning from a number of our businesses is, first of all, they're already requiring masking of their employees in some way. I mentioned the 70% number. We're also finding that, there are probably as many businesses who don't want masking as a mandate as there are businesses who don't really care one way or the other. They're just, tell me the rules, I'll follow those rules. And so, they're really agnostic about they just want certainty, and if anything about the pandemic has been true, it's that there is no certainty from one day to the next, and so they just want to know what the rule is in terms of keeping their employees and their customers safe, and they'll move forward with that. So in terms of what we're really hearing most of all is, please don't shut us down. And most businesses told us in the beginning, in mid-March, we can do it once, but we really can't do it again. So if wearing masks is what it's going to take in order to keep people safe, to bring the numbers down, and to keep my business open, then I'll wear a mask. And so in that case, that's where, I think we see, from back in the 80s, I remember, we had a lot of conversation about seatbelts. And, now that's just automatic. And so if, wearing a mask is, today's seatbelt argument so that we can keep our businesses open, I'm hearing a little bit of the turn of the tide from my businesses about that.
Jill, do we have time for one last question?
We do. Rebecca wants to know how well people wear masks. And if people are going to be, she sees them under the nose, on their chin, dangling from their ear. She just wants to know, how effective is it?
The dangling from the ear doesn't work very well, does it?
No. No. Again, the mask, and we have talked about this, while it offers a modicum of protection for the wearer, even the cloth mask, it is really for other people to serve as a barrier in case you are infected with the virus and don't know it. Or if you are out and you are ill, which you shouldn't be going out if you are ill. So, if you have it over your nose and mouth, you're covering 2/3 of of your mucous membranes, your eyes, your nose, and your mouth are your main mucous membranes that we say you can get infected by. But the mask is going to be covering the nose and the mouth, and that will cover any virus that's expelled. That will act as a barrier there. Obviously, if you have it below your nose, you're missing one half of that, so you can still expel virus through your nasal secretions and breathing out and things of that nature. Obviously, if it's below your chin or if it's hanging on your ear, it's not going to act as a barrier for anything, so it's really useless at that point. So it's really important to wear the mask above, on the bridge of the nose, and under the chin to really act as a good barrier against any virus that may be expressed.
Quick follow-up
And
question.
yeah, Donna had a really good point I thought she made that you guys can speak to, you doctors can speak to. And she just commented that, well, yeah, it's easy for you guys because you have access to surgical masks and they're probably the best. I think probably what was released yesterday is helping us understand that they all offer. But I also noticed you wear a cloth mask. You brought one in today.
That's right.
And you have access to surgical masks.
Well, I do when I come to work, and as soon as I leave here, when I go into the patient area, I put one of them on. But there's what we want to try and emphasize to everybody is the importance of wearing the masks. These sort of simple cloth masks, which are double layer, my wife made this for me. They are effective. If people would all wear these out in the community, and we had compliance with all of that, I think we're going to still have that same positive effect. And as a matter of fact, that has been studied. It's clear that when people are wearing masks, even cloth masks, there's a downward trend in cases. So, even though there's definitely some evidence that as you step up to each additional level of mask, they're more effective. N95s are the most effective, but you don't need to wear an N95 or a surgical mask for it to be effective. These cloth masks will work.
And as an aside, I haven't even been fit tested, nor have I worn an N95 mask since this whole thing began. I wear a surgical mask most of the time in the hospital. Even out in the community, I do have one of those Charlie Hustle KC masks. I also have a Jayhawk print homemade cotton mask as well. So I'm using all of those things.
And Dr. Smith, I said final, but I just got a text from Dr. Smith, and of course we know that he is our medical director of youth sports, and he wants you both to comment about kids wearing masks playing sports.
Well, I'll take it and you can run with it.
Go ahead.
I think in general we have always maintained, even with adults, if you are wearing a mask outdoors and you are active, it's going to be very difficult to wear the mask. In addition, now that we are getting into the hot summer months, you will start sweating as that mask retains moisture and does get wet with sweat. That's going to be even very difficult, and it's not going to act as a barrier much better or very well at all. So I think if you are doing sports, probably kids are not going to be able to wear the mask with doing sports. When I'm outside doing things, I know I don't want to be wearing a mask either, whether that's walking or running. And if you are outside, you can have a lot better luck and results in physical distancing from other people too. Most of the time on the fields, on the baseball field, even on the soccer field with very minimal few interaction, you're not going to have too much contact with other people. But I think in general, if you are out being active, whether an adult or a child, it's going to be very difficult to maintain a mask and keep it dry and keep it as an adequate barrier. I don't know if you...
So this is, of course, thank you. This is a very difficult question, and I can say, at least for one thing, that at least in the county level with Johnson County, where there are a number of different school districts, that we're in close communication with the superintendents, with the school nurses, that we're working on plans for what the reopening of school will look like. Already schools are reopening in the way that you mentioned. What is the right thing for schools to do? It is clear to me that if we have no county policy about this, that it will fall back on the schools, the school boards, the school nurses, and the parent bodies to make this up as they go from school to school. And what you mentioned, the whole thing about sports teams practicing together, that's only the tip of the iceberg. There's a whole lot more that's there. It will make it, if we had 100% of everyone agreeing to wear masks all the time, then this is going to make all those decisions much easier. Otherwise, they'll have to be sorted out at district by district level. And each school will have to make up their mind what level of risk they're willing to tolerate. And remember, when you're in a school, even if you have all the same children in the same group all the time, they also have family members at home. So whenever they're all together, if they're not wearing masks, then that opens up the possibility of transmission to all their family members. Some of those family members may have cancer or immune problems. All of this is just, this is only the very beginning of the sort of issues that will have to be faced if we don't have some means of universal masks, some agreement about how we're going to do this.
All right, we are going to wrap up today, but we're going to get to some of those questions that we didn't get to today. We'll get to those tomorrow. I just want to thank all of our guests for coming on and talking. Lots of great information. We're going to keep the conversation going. And I want to get some final thoughts from our guest. Dr. Hawkinson, I'll let you start us off.
All right. Well, I would like to get everybody to wear one mask before we get everybody to wear two masks. So I think one mask is going to be good. We know that this virus can get to the mountaintops in Tibet, in Colorado. We know it can be in rural Missouri and rural Kansas. Our knowledge has evolved from day one. Even Dr. Fauci said something to the effect at one point, I wouldn't wear a mask unless I was ill. Well, unfortunately, he is always wearing a mask now. Unfortunately, with this virus, you can spread a lot of this virus without even knowing that you're ill. So to appeal to people and their science and their rational thinking, there is now almost overwhelming, certainly significantly favorable science suggesting that wearing masks in public in these places where you can't physically separate is going to reduce the risk of spread and the risk of mortality from this disease. If we can appeal to your conscience for your other fellow citizens, we know that you are doing this for other people so that you don't spread it to someone who may be more vulnerable. These masks act as a barrier. They do also offer you some protection, but mostly it's a barrier so that in case you are infected and don't know it, you are reducing the risk of spread to those other people and those other vulnerable populations. We should note that it is safe. You have plenty of gas exchange, oxygen getting in, carbon dioxide getting out. Mask does not decrease your immune system. We have our most brilliant people and our most brilliant surgeons working on your brain and in your chest, on your heart, every day for hours at a time, doing the most intricate surgeries, wearing these masks. They are safe. You are safe for them doing it. The same thing can be applied here. If you just have to wear the mask for 5 or 10 minutes or 20 minutes while you're in Target or the grocery store, come out, do your hand hygiene, take it off. You're still going to be safe, but you will also protect other people while you're doing those things.
Really well said. Tracey, thank you so much for coming on today. We appreciate it. Some final thoughts as we get out of here today?
Absolutely. Thank you so much for the opportunity to really share just a little bit of time with all of these really incredibly talented healthcare professionals. From the business community, I love this opportunity to say thank you in person or at least virtually. From our standpoint, what you all do every single day is incredible to help stem the tide of this just horrific disease. And I really want to thank you on behalf of not just the Overland Park Chamber, but all of the business organizations for everything that you do every day to save the lives of those who are ill and also to help the rest of us stay safe. And then secondly, for everyone who is listening, for something that is not healthcare related, but really the next section of triage is for our local business community, and to thank everyone for supporting local businesses. And just as a reminder, business is open. They're open differently. They've had to really be resilient in ways that we've all had to be resilient. Staying at home and staying safe, but keeping them in mind about how we can support them and still do business locally as much as possible, because we need our economy to survive here in the Kansas City region, and there are lots of ways that you can do that. And if you need assistance in connecting with a local business, contact us or your local Chamber of Commerce wherever you're watching this from, and they're happy to connect you with those local resources. So thanks again for the opportunity.
Thank you, Tracey, and thanks for your info. We appreciate it. Dr. LeMaster, final thoughts today?
Yes, thanks, sure. Well, I want to also I'm very thankful for the opportunity also to be able to contribute here today, so thank you again for that. I think that the evidence now is crystal clear that wearing masks is the thing that needs to happen in every situation where people are together and are close to each other, that both people should be wearing masks. There is not any question about that. The science is incontrovertible, I think, that this should be happening. Now there are also additional economic analyses going on that are saying that if by using this approach to make sure that everybody's wearing masks, however we get to that, we can avoid another shutdown, that this will greatly help the economic situation that we're struggling with, that we're trying to recover from. I am willing to predict that if we do not do that, that the numbers will continue to increase, that they will continue to increase in the Kansas City area, and that that spillover effect will cause hospitals to be overwhelmed, and we will have to have another shutdown. It is only a matter of time. It is predictable. It will happen. Somebody may say, well, you don't know that, you don't have the crystal ball, but we can see in all the other areas around the country where that growth is happening, and we would anticipate that it will happen here too. We don't consider masks to be a magic bullet. There are many other things that need to happen. People need to continue to observe social distancing, physical distancing from one another. Hand washing is still important. This is all part of a picture of what we need to do to care for one another in communities. We strongly urge everyone to wear a mask, wash your hands, keep that distance going. We are not through this yet. It will be some months before we have a vaccine. As it started out at the beginning of the hour, we know that there's some question about how long after immunity is conferred by the vaccine, how long that immunity will actually last. We don't yet know that. So this is something that's going to be with us for a while. We need to do all we can to keep our economy going, and this is the way to do it.
Dr. LeMaster, thank you so much. And Dana, you had a final thought today.
Yeah, it's just a massive culture change. We understand this, and we just need to continue to promote the message. Again, appeal to the rational thinking, appeal to the heart. But we can do this if we keep promoting our message. Hopefully people will get the message sooner rather than later, so we can avoid exactly the things that Dr. LeMaster was talking about. And we will continue to promote it. And again, as the knowledge changes, we will keep you up to date on that as well.
Thanks to all four of our guests today. We appreciate it, and thank you all for joining us. I want to talk about tomorrow's show. We got Dr. Jessica Callender-Rich. She is joining us to discuss her national appointment to the Coronavirus Commission for Safety and Quality in Nursing Homes. We know that this is a vulnerable population that has been hit by this disease, so we'll talk with her about that. And as we mentioned before, we get a lot of questions from you throughout the week, so she, along with Dr. Hawkinson, will be here to answer some of those unanswered questions, especially as we head into another big holiday weekend. So we also have a special message from Dr. Stites coming to us from a gorgeous location in Colorado, so we're going to hear from him tomorrow as we head off for the 4th of July weekend. But today it has been all about masks. So we want to show you how some of you out in the community are keeping yourselves and others safe out there. So we just like to rip through these and show that. We appreciate you sending these in. This is Becky. She is doing it right. She works at the DoubleTree by Hilton out in Overland Park. So Becky, friend of ours, thanks for masking up for us. And then this is Jordan. She's heading into Hen House, out doing some shopping. So Jordan, thanks for showing us how that's done. Yep, we get a little applause for these people. We love that, right? And then we have little Miss Audrey. Little Miss Audrey's doing some shopping. So I figured if these little kids can do it, I think we can do it. And then, okay, so this, I have to show you. So this is a friend of mine. His name is Travis Clore, and I'm going to tell you exactly why I love him so much. You guys will too. So he is the longest running Frankie Valli that played in the Broadway musical Jersey Boys. He is an amazing singer and talent out in Las Vegas. They are on a statewide mandate also for masking. So he's showing us how it's done. But the reason I love him so much is because he's a Kansas guy. He went to K-State. And we do love our K-Staters, right, Dana?
Absolutely.
Yes,
Sometimes.
we do. So
We have to have
Just
them
not
so
on
we
the
can beat
football
them.
and basketball.
absolutely, right. So Travis, anyway, thanks for showing us how you're doing it out in Nevada on the West Coast. And a little shout out to our Wildcats out there. So anyway, everyone, thank you so much for sending those in. Keep sending us those pictures because we really like to demonstrate how people are social distancing, wearing masks. You can send those to our Facebook page or email us at medicalnewsnetwork at kumc.edu. And as we are telling you this week, we really want to share your stories too. We know that many of you have been impacted in many different ways by this disease, and that it's serious and that it's deadly. And we really want to put a name and a face to these cases and help really educate the community on how so important this is. Again, you can send those stories to Facebook or Medical News Network at kumc.edu. So thank you so much for joining us today. We're so glad you're with us. Dr. Stites will be back on Monday. We will be back tomorrow. Make it a good one.